Hi, everyone. Welcome to Pet Connection Unleashed. It's going to be a great show today. One of my dear friends for many, many years is joining us. We're going to talk about the health of your pet and things you should be keeping an eye on, especially during the spring season. This show is sponsored by Capital Land Motors. They're big supporters of helping animals, years of serving the capital region. Their sales team, certified technicians, dedicated finance professionals work together to ensure your needs are met and your expectations are exceeded. They believe in fostering long-lasting relationships. Capital Land Motors has a full inventory of new Subarus, GMC trucks, as well as a fine selection of pre-owned vehicles. Visit them online to get all the details. All right, without further ado, special person, Dr. Lexi Beckert from the Animal Hospital in Slingerlands. Doc, it's great to see you. You've been a dear friend, obviously, of my family for many, many years, and your dad as well.
Of course.
Today we're going to talk a little bit about things you got to be aware of, especially during the spring season. Last week, I had talked a little bit about allergies in pets. And I'm no expert. I'm dangerous if you give me a little knowledge.
It made sense.
Yeah.
Good. I watched. It was very good.
But
very
coming
good.
from you, it will be a lot better in terms of treatments and medications. There are different types of allergies. There's environmental.
Yes. Yep.
And then there could be something in your house or food and things like that. And
Yeah.
I know you always said it's difficult sometimes to figure it out.
It can be. The symptoms are usually very similar for all types of allergies. And most commonly, we will see those environmental allergies. But about 10 to 15% of dogs in the population have something called atopic dermatitis, which is actually a hereditary condition where there's a defect in the skin barrier. So they're so much more sensitive. The allergens are actually going to penetrate into the skin more and cause this massive inflammatory response that another dog might not have. So that's really kind of the background for the environmental allergens. And a lot of times there are skin tests you can do, there's blood tests you can do. But now we have such great medications available to us that are cool things like monoclonal antibodies. They're injections that we can give them to block that inflammatory cascade, or oral medications that do the same thing.
You know, Rob and I were talking about this, the itching, the scratching, all that stuff, maybe the eyes. Those are all things, when you start to see that, you know something's going on.
Absolutely, yeah, and those are the most common symptoms, especially licking feet. People always comment on that because it's obviously very distressing for the pet, but that definitely gets people up in the middle of the night.
Yes, that's all you hear.
Yes, exactly.
And this goes for cats and dogs,
Cats
right?
and dogs. Cats, not as much. They get more of kind of like the systemic inflammation. It's a little less likely for them to have like feet licking specifically. With cats, we see more like flea allergy dermatitis, a little bit less likely the environment.
Now, we've all gone through this. I know you've seen some of my pets that have had this, the hot spots. When they scratch and they scratch and they just don't stop, and it really tears into their skin. And that's something that needs to be treated as well. You can't mess around with that.
Absolutely, they do. And they crop up so fast. I can't tell you how many times we'll have a client call and be like, oh my gosh, just literally disappeared overnight. And a lot of times it does. So it's basically an infection that occurs because of the massive amount of inflammation that's occurring in the area that they're traumatizing. And it does oftentimes require topical or oral antibiotics.
And, I mean, it's one of those things that's very treatable.
Yes, very much so.
But you got to go to the vet to make sure you're. So, if you see something like that, and,
it's best to try to catch it quick, too, probably,
catch
right?
it early.
For sure.
And, sometimes you put things off, but you don't want it to get infected. And then you get a bigger problem,
Absolutely.
I would think, down the road.
Absolutely.
If your pet gets allergies every spring, can you almost say it's probably some kind of tree pollen or something?
Most often, yeah, especially if there's a seasonal component to it. It's usually something in the environment that they're reacting to.
Now, what about food allergies? I know that's so complicated with, is it chicken? Is it beef? Is it, how do you even begin to deal with that?
So that can be tricky because it is something that it's usually a reaction to the protein source in the food. So most often it is chicken or beef. But there isn't any sort of easy testing you can do. It has to be an elimination diet, which is so challenging because you either feed a novel protein, so something they've never seen, or a hydrolyzed diet, which is basically when the protein's fractionated into these teeny, teeny pieces so the immune system doesn't recognize it as foreign. And by feeding that exclusively, so you have to be careful with treats,
Exactly.
medications, everything like that, then you determine if they're responding positively to it. But it can take a long time. It can take 8 to 12 weeks. Thankfully, most patients respond, like 80% of them, within 4 to 6 weeks. So you'll have some idea.
And I was told this. I'm not sure if it's true or not, because so many people feed chicken and beef. A lot of times that is probably the problem. When you go to a different protein source, it may be all you need to do.
A lot of the times the change is. The tricky part is if you're doing a true food trial, using over-the-counter diets can be a little challenging because they're oftentimes processed in the same place. So if they have a true food allergy, even just the littlest bit of that protein is going to cause an issue for them.
So you got to be careful. There's no doubt about
Yeah, that
it.
elimination diet's key for the food allergies.
Okay. Rob, do we show some of the pictures of the animal hospital? I just want to say, if you've never been to the animal hospital, it is like a park. There's no other... I'm glad I don't have to mow that lawn.
Yeah, me either.
Jay does that.
He does. He does a beautiful job.
And I like he does the
love
design.
the stripes.
Yeah, why doesn't he come to my house and do
Right.
the design like that?
Right.
But it's beautiful. You can take your dog for a walk around. There's some beautiful woods and fields in the back. And this is another shot that I think is absolutely, well, this was one of our
Oh, that was adoption day. Yep,
that was one of our big
wonderful.
adoption days.
Yes.
Which we'll
The grounds
bring back.
led to that, which was wonderful.
Yeah, and we get 2,000 to 3,000 people, and you guys were always gracious enough to help with adoption fees, open up your grounds. We're stomping on everything.
It's great.
And we had 30 groups there.
Yeah.
Just absolutely beautiful for that. And here's one more. And when you pull in, this is what it's going to look like.
Yep.
That was just taken recently,
It was
right?
taken recently. Yeah.
Is that not the most beautiful
It is.
hospital?
And set back too. You
It's
don't
set
even know.
back.
You don't hear anything. You know
It's
what I
so
mean?
nice. That's the nice thing is,
Yeah.
we're set back. It's kind of quiet. It's a peaceful location. We, the doctor's offices are in the windows there, the big windows.
So you can look
we
out.
just look out and see the deer walking across the front yard.
Well, but that's
nice.
part of the thing that you do in all your staff, which I think is tremendous, is you make it as least stressful as possible for any of the pets. I mean, some pets just they get in the car and they go, uh-oh.
Yeah, where are we going?
Where we going? It's probably
We
not
know.
good.
Yeah.
Yes,
But
yes.
when they enter the hospital, you do your best to make them feel so comfortable, so relaxed, and you want it to be a good
We
experience.
really try to, it makes such a huge difference to just their overall experience and our ability to determine what's going on with them. If they're stressed and anxious, getting that physical exam, that's going to determine exactly what's going on is so challenging.
Right, they'll
So
have
we really do-
respiration will be up,
They're
and they'll
stressed.
be
You can't really feel their abdomen well.
can't hear their heart because they're
Exactly.
panting so much.
Yeah. So there's actually this certification, fear-free certification that all of our doctors have that really actually focuses on that, which is pretty neat
Yeah.
because it's a whole ever-encompassing
Well, you
journey.
don't think of it, but that's part of the whole medicine.
Yeah, it
is
is.
you have to try to get that pet relaxed as possible so you can diagnose what is going on. This time of year, I've always thought the spring. You think about basic shots
Yep.
for your pets.
Yep, sure.
Just go over some of the things that we really, for dogs and cats, what you should have at minimum.
Sure. So there's basically two kind of categories of vaccinations. The core vaccines, which are recommended independent of lifestyle, unless of course there's a medical exemption, and then the non-core vaccines, which are more kind of based on geographical location and the lifestyle of the pet. So the core vaccines for dogs are the distemper vaccination, the rabies vaccination, and as of 2024, the leptospirosis vaccine. Those are the core vaccines.
is that?
Lepto is a bacteria that is found in the environment. It's actually mostly transmitted with like urine and like stagnant puddles, stagnant water.
If they're drinking that
If they're
water?
drinking it, yep. And it causes, actually, attaches to the blood vessels, but ultimately it causes really bad kidney and liver disease.
Really?
It's treatable if it's caught early, usually about 80% success rate with doxycycline, which tends to be such a great antibiotic. But it is something that you do want to catch early, and the vaccine does prevent against that.
And rabies is the law,
Rabies is the law. Rabies is the only one mandated by New York State law.
but you should have now around here because we're so tick infested.
Oh, yes.
I mean,
yes.
do you?
Yes. So that is technically a non-core vaccination, but
Yeah.
in our area, my goodness, we just see so
Yeah.
much. It's endemic. We see it everywhere. So the Lyme vaccine is definitely a good idea. The efficacy of, there's lots of different types of Lyme vaccinations. The efficacy of prevention is a little questionable, but it definitely limits disease, limits the
So-
manifestation of disease.
You can still do those preventive measures,
Yeah, you have to. Yep.
but the vaccine is like the insurance policy.
It does.
that-
It helps. It absolutely does.
Different tick diseases too. It's not just Lyme anymore.
Not just Lyme, no. So we are seeing more and more anaplasmosis, and that one actually presents very similarly to Lyme disease. They can be lethargic, they can have the same sort of like joint discomfort, but in 40 to 60% of dogs that are affected with anaplasma, they can actually develop low platelet counts, which is something we're seeing more and more.
No, so that is a more serious
It
tick-borne
is.
illness.
It is. Yeah, I mean, so Lyme has its set of complications as well, but
Yeah.
when they do have the low platelet counts, it can be really bad. They can also develop an immune-mediated component to it, where their immune system starts to actually destroy the platelets, and that ends up being a whole different line of treatment as well.
Well, is the basic treatment for both similar?
It is. Doxycycline is absolutely where we start, and then depending on the additional issues that occur,
What would be a symptom that you would look for if in your dog or cat that they might have Lyme?
So it's mostly dogs. With dogs, they are such vague symptoms. So sometimes we will end up finding that they're positive for exposure on just routine screening, and we'll go back and ask, hey, have they been a little lethargic, just a little off? I'm like, maybe. We'll treat them, and a week or two later, the owners will call and like, oh my gosh, they are so much
So when
better.
you do like a basic blood test, you can put that as one of the tests.
Absolutely. It's one of it's basically a combination test. So it's heartworm, Lyme, anaplasma, and Ehrlichia.
How's heartworm around here?
Thankfully, we don't see much of it. We do see some, especially with the transport of some animals from down south, and there's kind of this latent period where
Yeah.
they don't always show up on tests. But for the most part, we really don't see it
You
too
were
much.
saying something interesting. It takes a while
It can.
for heartworm to show up
Yes,
in a pet.
it can.
It's not like you get bit by a mosquito and you get heartworm.
Right, exactly. It can take up to 6 months for it to show up on testing.
So the incubation period is a long time.
It can be, yeah.
Puppy season. Rob and I don't want puppies.
No more puppies
No
for
more
me.
No. And it kind of drives me. How are we doing on time? I tend to yak.
We are at 13 and a half minutes.
Okay.
So that's where we're at right now.
Okay. With puppies, people say, well, my puppy's healthy and I'm not going to get shots right away, or it's a free puppy they get. I always say nothing's free. There are some important vaccines that you need for puppies at
Yes.
certain ages as well, I would imagine.
Yes. So the main core vaccination is the distemper vaccine. So that includes distemper virus, adenovirus, parvovirus, and parainfluenza. And the two big ones in that category, especially for puppies, are the distemper and the parvovirus.
Right. I mean, they're both horrific diseases,
They are.
illnesses.
They
that
really
that
are. And the vaccine's so effective.
And like you said, a lot of dogs that are being transported, a lot of puppies that
Yes.
transport up here,
Yes.
you don't know their medical
You really don't.
standards
You
down
don't.
south. And
No. And with distemper, it can be in the environment. Raccoon, skunk can carry it. So it's definitely something that they can be exposed
When
to.
does a puppy get a rabies shot?
Usually around 12 weeks of age. They have to be at least 12 weeks of age. And New York State wants them to be vaccinated by 4 months, so within that window.
And same with the other vaccines, or is that
The so the distemper vaccine, you start around 6 to 8 weeks of age. And then you want to do a booster every 3 to 4 weeks until they're about 16 to 20 weeks of age.
I know this is probably a strange question, but it comes up all the time for me. What's the difference between a 1-year and 3-year rabies vaccination? Because some people say, well, I went to a clinic and they said I had to get a 1-year, but my dog already had a vaccination. What is the difference between the two?
So it's a little bit of a tricky thing where the first rabies vaccination always has to be a 1-year vaccine. You have to get that booster within 1 year, and then it can turn into a 3-year vaccination. So if you don't have documentation that they had that prior vaccination, then it has to be a 1-year
So that's what it
vaccine.
comes down to. If you have the vaccination, keep the paperwork so that
Yes.
if I go to you and say,
Right.
time for my annual booster,
Yep.
you say, we can give you a 3-year.
That's right. Exactly.
And you don't have it, you can't give it, I
Right.
would imagine.
Right, exactly.
I want to go through some of the pictures here of the hospital, because it's amazing. Special
Oh,
lady.
that's Jody and Hayes. So sweet.
Jody's super, super nice.
She is. She's amazing. She does it all too. She's been in the field for a very long time. She right now is one of our client service representatives, one of our receptionists, but she does tech appointments and assisting, and she's wonderful, and the pets love
Dog
her.
looks like she's smiling.
I know. So cute. That's Dr. Becky. She's fantastic.
She's really, really
She
nice.
really is.
Yeah.
She's wonderful. She's so sweet and so knowledgeable. She's really
Well,
fantastic.
you guys have a
at-
great team there. There's
She
no
is.
doubt.
We're lucky. We do.
You work together.
Great team. Oh, yes, that was at a continuing education that we did. That was a really cool one. It was an ultrasound CE that was really hands-on. I feel like, having that hands-on experience, we were able to really bring back a lot of that information. And both of us we were kind of vowed, like, okay, we're going to do many ultrasounds as soon as we get home. And we've been doing it. So it's been really, really helpful.
Veterinary medicine, technology, the equipment, I'm
It's
sure.
got to be
just-
constantly changing,
It is.
right?
Changing, yeah.
Constantly changing.
And you have to keep up with
Absolutely, it is. Yep, it's exciting. It really, when you bring back information like that and can share it with everybody else
Right,
and
and this-
apply it, it really.
it. And this new stuff they didn't have when you were going to college.
Right,
So
right,
it's,
exactly,
it's
yeah.
you have
the
to
utilization
really.
is so much different.
Yeah.
So it's great. It's exciting. It keeps it exciting. That's Marissa in the lab. We're able, thankfully, to do any of the diagnostics that we would really need to do in an emergent basis in the hospital. So if we have any sort of,
It is great to get the results fairly.
we have to,
fairly quick.
yeah,
You don't
in
have to
certain
wait.
situations. Yep.
Sometimes you do send them out, but
We do. There's
but-
certain tests we have to, but
Some-
for the most part, can do if we
Reduces
needed
anxiety if you're able to get the result very quickly,
Yes,
you know?
absolutely, absolutely.
I love that
Oh,
picture.
there's Brenna and Jody. Brenna's one of our amazing technicians. She's
She is
doing a tech
amazing.
visit there.
And she's a good friend of all of
Yeah.
us.
She
you know.
is.
Yep.
She's fantastic. Oh, there's Karen.
Karen is
She must be able to do. She must do everything.
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 That's an understatement. She really does everything. She really is just the backbone of our practice.
She
She's
does all the
phenomenal.
business stuff.
All
and-
the business stuff. She jumps into on the floor and does
Right,
all
she
of the
can- she-
technician things as well.
yeah,
and
she can do anything.
really anything. She's just incredible.
There's the
there we
cast
are.
of
There's our-
characters. What a
There's
great
our
group.
group. Yep,
Yeah.
yep.
It's like I always say it's like family.
It is. It really is.
Everybody gets
Absolutely.
along.
We really do. It truly, we call it our work family. We really do. We're very lucky. We have a great team, and we all work together. Really, for the common goal, everybody there is there because we want to do the best we
Next
can.
picture, please. I don't want to run out of time.
She was still talking, so I didn't want to skip ahead.
Lex doing an exam of a bunny.
Yes, that's little Angie.
So right, and you have to bring bunnies to be looked at
yes,
too. I
yes,
mean,
yes. We see the exotics too. There's Dr. Jeremy. We missed him in the group picture. He's out on paternity leave, but he's coming back soon, so we're very excited.
and he does his primary thing a lot of times.
He
is
loves the exotics. Yeah, he does it all, but he really enjoys the exotics and the wildlife.
That's fun.
Yeah.
Surgical
There's our
unit,
surgery
right?
suite. Yep, we have the lap tower in there, which I just love. So nice to be able to do the laparoscopic space.
Well, yeah, laparoscopic surgery is less invasive,
Yes.
obviously.
It
It's so
is,
much better.
yeah, and it's really quite amazing to see the recovery times being so much different with the patients who have a lab spay. I oftentimes will say to people, okay, now your challenge is to actually keep them quiet because within 24 hours they are raring to go back
Well,
to their
and then
normal.
like when you're doing a spay on a dog or a cat and you have a tiny little incision as opposed to
yeah,
a larger wound.
I didn't even think that they
Right.
were doing that
right.
Yeah,
on animals. I guess it makes sense, I guess, but I wouldn't have even thought.
You know, they're not wearing the cone of shame for like
For as long,
for
yeah,
as long,
yeah,
you know?
exactly, exactly.
One more picture, I think.
Yep.
I
Oh,
want
yes.
to talk AAHA. What does that represent?
So we call it AHA. It's the American Animal Hospital Association, and it is it's a really cool organization. It's a voluntary accreditation organization that sets a standard of basically excellence within the veterinary field. So by following these, I think it's like 900 plus standards that they put out, you really can assure that you're providing the best care.
Now, they'll come every 2 or 3 years?
3
or
years,
Every
yep.
3 years,
They come
and they
do an
do
inspection.
a complete inspection of
Yep.
everything?
Yep. So they walk through the hospital, talk to the entire team, look at all of our policies and procedures and medical records, assure that we're doing everything we can for patient care and client communication.
There are 4,500 accredited
Yep.
animal
I
hospitals.
think it's somewhere in there. I know about like 15% of the.
So there's other hospitals that don't have accreditation. So is that something you kind of should look at when you're looking at a hospital?
So I think, the nice thing about the accreditation is you can be assured that the hospital that's accredited is staying current with the latest technology, the latest standards of care. They're using all of the right protocols. So it's just that extra assurance that gives pet owners peace of mind that these hospitals are
So
doing
they
what
should have that probably on their social media or their website
Yeah,
for you to,
for sure.
or if you don't know, ask them.
That's right. Absolutely.
Now,
Absolutely.
I'm going to do this. I want to just say that the animal hospital is right now one of the top 30 hospitals in the entire country. They go through and they inspect all the hospitals and they come up with a list. And the animal hospital, out of all those thousands of hospitals across the country, the top 30. So congratulations.
Congratulations.
That is
Thanks.
quite an honor, and I'm proud of you guys.
Thank you.
But
Thank
it is amazing. If you've never been there, stop on over and just say,
Yeah.
just meet some of the staff
Absolutely.
and say hi.
Yeah.
All right, we're going to take a break because I know I've been yakking a long time.
Just a little bit. It's okay though.
We'll be back with more after this. Hi, everyone. Welcome back to Pet Connection Unleashed. This segment is brought to you by our good friends at the Animal Hospital in Slingerlands, Dr. Lexi Becker, right next to me here. And her dad started it back in 1974, and it's always nice to see a family practice stay in the family. I think that makes it absolutely unbelievable. Fear-free environment, we talked about that. Focused on keeping your pets calm. They have the latest in technology. They treat not just dogs and cats, but they also treat exotics and wildlife. Can you punch Lexi up? I know I shouldn't do this, but you're one of the few hospitals that will take in birds of prey as well, right?
We do. We see all of the wildlife, and we work closely with North Country Wild Care.
DEC, I would
Yep, and they send a lot of the birds of prey, and
And I've had the privilege of seeing some of it. It's really,
really,
and
really.
the best part is when you can release them.
Yeah.
Oh, it's majestic. Really is.
They've been a huge supporter of Pet Connection for so many years. Adoption events, helping rescues. Dear friends of my late wife, Lisa, she loved you guys like family. She was there a lot. Now I'm there a lot with my pets. So thank you for everything. We really, really appreciate it. All right.
Thank you.
We got some stuff coming up.
Yes.
Rob, I know I'm going to go through these fairly fast.
Yep.
We have, and most of these I'll be at. May 7th, the Whiskers Gala at the Italian Community Center on Washington Ave Extension. Begins at 5. I am the guest speaker. I can't wait. I haven't done that in many years. May 9th from 10 to 2 at the Capital District Regional Market in Menands. I am going to have a big adoption clinic. 9 rescues and shelters will sponsor $50 off the adoption fees. If you've never been to the farmers market, it's a great venue. Rob, you've
Especially
been
when
there.
the weather's nice.
When the weather's nice. We've done them in the winter.
Yes.
A little bit cold.
Kinda
but
chilly there.
Yeah, and don't forget, May 16th is the celebration of life for Lisa. We're working on it now. It's all coming together at the pavilion at Orchard Creek in Altamont. It's open to everyone. $25 donation. I will feed the first 400 people. And then when you run out of food, you can buy food. 2 great bands. We're going to have Skeeter Creek and we're going to have Big Sky Country. It's going to be it's a day to celebrate. I promise I'm going to try not to cry. It's going to be hard, but I want it to be a day when we can all laugh and remember what Lisa did for so many people and pets. It's going to be a great day. May 30th, 5 to 10 p.m. is the Mohawk Hudson Gala for Animals at the Albany City Center. I am proud to be the co-MC again this year. I think I've done it for like so many years. Huge fundraiser. I know, Lexi, you've been to that event. It's
Great event.
It's a great event. It's a special night. June 7th, 10 to 4, Woofstock. It's a music fest. It's a 5K run and dog walk. Vendors, live music. I will be there. It's at Lions Park in Scotia. It's a beautiful venue, Lions Pavilion. Just type that into Google Maps. It's easy to find. June 13th, I'll be the MC of this event. It's a Midsummer's Night Rescue for the Montgomery County SPCA at the Falls in Glenville. Any of these events, you can go to their websites or their social media, purchase tickets, learn more about the events. But I am really excited about being part of those events. So that's it, Rob. I think I've yacked enough. Dr. Lexi, thank you so much.
Thank you.
Rob,
I didn't say anything, so I was just kind of here today.
well,
I learned a lot, though.
I tend to have a big mouth. You
Wow.
know that. I tend to
You
yak.
run the show. It's your show.
Well, thank you for producing it for
course.
us. And thank you, everybody, for joining us. We will see you next week.
Have a great week.